Dear patient, if you're a first-time mom or first-time parents, don't skip this video. This video is very important because I want to talk about the vision development of babies. Last night, one of my distant family member called and was telling me about her baby. This is just 1 month she gave birth, right? 1 month or getting to 2 months, I'm not too sure. She called me to complain about something she has noticed about the eyes of her baby. And I told her, oh, you are very lucky that this weekend I'm going to be in Owerri because I have something to do, so I will visit you to look at the eyes of your babies. Before that, I also spoke to her about some things that she needs to know about the vision of babies, and I thought it would be very important for me to also share it here for my followers that are first-time mom or first-time parents. From 0 to 1 month, the vision of a baby is very blurred. Despite the fact that sometimes when you put your face on their face and smile at them, they smile back, it doesn't mean that what they are seeing, they are sure of what they are seeing. In fact, babies at that month, from 0 to 1 month, what they can only look at or focus at things that are 8 to 12 inches close. So you can see 8 to 12 inches close. Anything beyond that, babies cannot see. And this is what makes them far-sighted at birth with some amount of astigmatism. Even at this age, babies are very sensitive to light. That is why you need to be careful on how you take them out or how you shine light around them. So you have to be very careful because their eyes have not developed to be able to know how to control the amount of light entering their eyes. At this age, most of them, when you look at them, their eyes looks like it's inward, like it's going towards their nose, and this condition is known as esotropia. However, most cases, babies outgrow this esotropia. By 2 months, your baby, whose visual development process is going on well, they start getting familiar or used to their mommy's face, their daddy's face, or if their parents have a nanny or a help who helps in taking care of her, this baby is also able to differentiate their face. So that's why at this point, when they look at you and you look at them and smile, they smile back. By 3 to 4 months, there is something we call color vision development and depth perception. At this point or at this age, the color vision and depth perception of your baby start developing, so that by the time they start talking, when they see white, they will say, this auntie is wearing a white polo, this auntie is wearing a blue jean, this auntie is wearing a brown belt. They will be able to differentiate that. So this development starts by 3 to 4 months. Now, by the time your baby gets to 6 months, baby is already familiar with daddy's face, mommy's face, auntie's face, and then he or she is also able to differentiate between close family members and strangers, like when your neighbors who come once in a while. That's why sometimes when they come and then they want to carry the baby is dodging. No, I don't want it. That is because they know that this person is not their mommy, this person is not their daddy, this person is not their auntie. So why is my mommy giving me to this stranger? That is because at this stage, they are able to tell who their mommy is, who their father is, and who a stranger is. So most times when you now want to give them to this stranger or this neighbor that came to visit you people, she will say no, she doesn't want to go to that auntie. That is because her vision has developed to a point where she can tell when there is a danger or when everything is okay. And it's also at this month that the vision of your child undergo what we call emetropization. Emetropization simply means the stage or development or visual process where the eye develop without having any visual impairment or disorder. If at this age this process is not complete, then it means that this child will require assistance or help in order to complete this process. And mostly it can be that they will give your baby eyeglass and not